100,000 people get mammograms every day. And
about
like
right.
we talked about, is that correct? Is that the right number?
Yeah, it's probably close. I mean, the American Society of Breast Surgeons, American Cancer Society recommend that women over 40 get a mammogram every year. So that's probably an accurate number. I mean, if you figure there's 340 million people in the US and probably half of them are women.
What is the percentage of women that don't know how to give themselves a self-examination?
I think, when you talk about how to do a self-examination, there's no like one size fits all way of doing it. And they talk about doing it in the shower and, like holding your breast a certain way. I don't know if you can kind of see here, just holding it a certain way so you can compress the different sides. Right. But it's the kind of thing, though, where something is better than nothing. And so even if you're not doing it perfectly, if you're doing something, it's better than nothing.
Yeah, I'm a testicular cancer survivor. And, at the first of the month, I try to check the boy. There's only one left, one nut and still balling. But I think it's still important. And it's uncomfortable to have the conversation talking to other men. But at one point, I was a huge advocate for testicular cancer checkups, because you have to, I would imagine, the same way that women do, guys are doing the same thing as well. But it can be uncomfortable. Sometimes a lot of women don't want to talk about their body, whether it's to other women or to other men. And so that's why I wanted to take this time as well to let people know that it's okay to have this conversation, because this is your health we're talking about, correct?
Yeah, absolutely. And, it's one thing about breasts is that there is no set like normal versus abnormal. And some breasts are firmer and some are softer. Some are bigger, some are smaller. We always say, especially when women come in to talk about different types of breast surgery, we always say breasts are sisters, not twins. It's not what is normal, it's what's normal for you, because everybody's a little bit different.
Right. Earlier, Dr. Hirsch, we talked about the women that if they tested positive for a certain gene, that they were is the correct term mastectomy?
Correct. Yeah. Yep.
Are you still seeing, and I don't want to call it a trend, but are you seeing women being proactive with that and going to see you to have that surgery? Or was that kind of like, hey, there's actual science and you don't have to go to that extreme or take that precaution now as it was a couple of years ago?
No, it's still very much. So the most common genes are the BRCA1 and the BRCA2 genes. Mm-hmm. And, you got to remember though, most breast cancers are not genetic. It's something like under 10% of breast cancers are actually genetic. Wow. So most people who get breast cancer are not genetic. But if you do have a strong family history of breast cancer, like if your mom, your sister, your maternal aunts, or grandma, they will probably test you for those genes. And if you do have those genes, then the lifetime risk of breast cancer is extremely high. It's like 85% or more. And so if you do have them, and you're not quite ready to have the mastectomy and reconstruction when we put the implant in and give you a new breast, then they'll often do what we call a high risk screening protocol, where they'll screen every 6 months with a mammogram. Mm-hmm. And if there's any change, then they'll know it.
There's a lot of younger women who they may feel something and they're not sure exactly how to handle that situation. And there's women that are over 40 who have not been to the doctor or even had a mammogram. And as crazy or as hard to believe, I'm sure you've heard that before, but I'm running for mayor here in Phoenix, Arizona, and I've just talked to so many people in different neighborhoods across different socioeconomic neighborhoods and, whatever you want to say here, all walks of life. And it doesn't matter. I think that one thing that people have in common is it doesn't matter how much money you have. Breast cancer can happen to any woman.
Yep.
And this is why I wanted to ask you and talk to you, Dr. Hirsch, because what are some things that you think maybe cities or local government can do to help women and make sure that they get the resources or at least the availability for mammograms?
I think, the simplest thing that can be done is education, and just tell women that at the age of 40, we recommend that you start the screening process. And I can't even tell you how many patients I have who they're over 40 and you ask them, when was your last mammogram? They say, oh, yeah, maybe like 5 years ago, 10 years ago. And you're like, what? And so step one is just letting people know that, hey, this is something you should do. And then step two is making it readily available. And that's the tougher thing. But most of the time, if women go to their doctor and they ask for a mammogram, they can get that done, at least in the big city, like a reasonably timely fashion.